Quality in phlebotomy. So features of quality phlebotomy will help to ensure the better patient care by reducing errors and increasing efficiency, making the delivery of care the most efficient. So quality phlebotomy refers to a set of policies and procedures that are designed to ensure the delivery of the highest quality patient care and consistent specimen analysis. This also helps to ensure better patient care by reducing errors and increasing efficiency. Quality control, or QC, refers to the quantitative methods that are used to help monitor the quality of procedures. We do this by regular inspection and calibration of our equipment that we use, and that helps to ensure accurate test results. QC is part of a larger program called the Quality Assurance, or QA, the larger set of methods used to guarantee quality patient care, and this includes the methods used for patient preparation and collection and transportation protocols as well. QA programs are mandated by the Joint Commission. The Joint Commission standards require that a systematic progress be in place to help monitor and evaluate quality of patient care. The Joint Commission stresses the collection and analysis of data to understand where the organization is weakest and where to focus on improvements. So the team approach improves production by reducing errors and waste, thereby resulting in a reduction of healthcare cost. Total quality management, or TQM, will actually focus on gradual, continual improvements of the quality of services provided by the laboratory. So rather than setting a minimum standard to be met, the total quality management philosophy will actually see the potential for improvement in every area, no matter how high that current level actually is. And this is just to help improve the services provided to our customers, also known as our patients. Our customers, like I said, are our patients, but they're also our physicians and other healthcare providers who order tests and personnel who use test results to provide treatment as well. Quality assurance and quality control. So quality assurance guarantees quality patient care through a specific program, which includes both technical and non-technical procedures. The QA program will use written documentation to help set those standards for the performance of the procedures, to monitor compliance, to make sure we're doing what we say we're doing, basically, and to track patient outcomes with scheduled evaluations of all lab activities. So documentation provides written policies and procedures covering all services and will provide evidence that standards have been met and that the work is being performed efficiently. If there is a problem, documentation will help to provide a means of monitoring the actions taken to help resolve that problem. So if we run into an issue, we have documentation, we can go in and try to get down to that root cause to figure out what is actually causing it and make it better. QC is part of the QA. So QC requires documenting equipment inspections, calibrating the instruments, and monitoring the protocols that are used in each step of phlebotomy, from patient prep and identification all the way through the collection procedures and equipment, and then all the way to the transportation of specimens and distribution to the laboratory. Procedure manual, so I'm sure you've heard me say this before a few times in different lectures, but the procedure manual is present in the department at all times. Sometimes it's a paper copy, sometimes it's electronic, so just make sure you know where to find yours for your facility. It is going to contain all protocols and other information about all the tests that are performed in the lab, including the principle behind the test, the purpose of performing it, the specimen type that you need to draw, the collection method, and the equipment and supplies that are required as well. Directory of service. So the directory of service will contain a variety of information that is used for smooth coordination of nursing staff and lab personnel. It will include lab test schedules, early morning collection schedules, written notification of any changes that have occurred, plus information on patient prep, specimen types, handling, and normal values. So monitoring of variables. This is performed and documented to ensure that its impact on test results is minimized. The phlebotomist is most responsible for controlling the pre-analytic variables. So a variable is any factor that can be measured or counted that affects the outcome of a test result and therefore ultimately patient care. So those pre-analytical variables, like we mentioned, falls heavily on the phlebotomist, and this occurs before analysis of the specimen. Analytic variables occur during specimen analysis, which can be affected by pre-analytical variables such as collection time or transport conditions. Post-analytic variables can be delays in reporting results or improper entry of results into the computer. Also may be part of the phlebotomist's responsibilities depending on where you work as well. Requisition handling, there are variables to be controlled, which include duplicate or missing requisitions, tests left off the requisition, missing patient numbers, missing doctor name, no priority is indicated on the requisition. So they need to make sure that they are accurately and completely filled out with the patient number, test, and priority. The QA procedures for these variables include recording and counting the numbers of each type of requisition error, and that is because if we need to provide education, we have the documentation to show what type of education we need to do. Equipment, so tubes should be checked. The stoppers should be checked for cracks or improper seating. Tubes may lose volume without any visible sign of defect as well. Needles should also be checked for any defects, and the syringe plungers should also move freely in the barrel, so make sure they're not sticking. Expired tubes, so tubes need to be checked for the lot number and expiration date. Never use an expired tube. And tubes may lose that vacuum, like I mentioned, without any visible sign of defect. If that does happen, we need to make sure we are documenting what tube, lot number, stuff like that, because it could be a bigger issue. Patient identification, as mentioned, it cannot be emphasized too strongly that proper patient identification is actually the most important procedure in phlebotomy. If you have improper identification, it can lead to injury or death. So we need to make sure that we are checking everything. So proper identification is made when the patient number on the requisition matches the patient identification band, and that band is attached to the patient. A delta check is actually a QA procedure that helps spot identification errors. So a delta check, what that is it compares previous patient results with current results. If the difference, or delta, between the two sets of results is outside the limit of expected variation, it will actually alert laboratory personnel to the possibility of an error. So the wrong patient drawn, something of that nature. Patient preparation. So we have posture. A sample is collected from an erect patient, has higher concentration of large molecules such as enzymes and albumin, as well as white blood cells and red blood cells to compare to samples that are collected from a patient lying down. Short-term exercise. Exercise can increase levels of muscle enzymes like creatine kinase. It can also increase your white blood cells, creatinine, and fatty acids. Long-term exercise, so a prolonged exercise regimen can increase sex hormones as well as many of the values increased by short-term exercise. And if the patient is taking medications or going through certain medical treatments, it can affect test results as well. Aspirin is a common one, and that will actually prolong their bleeding time. Alcohol consumption, although moderate amounts of alcohol do not affect test results, except for the alcohol test, the glucose can be slightly elevated, and chronic consumption of alcohol can lead to the increased values of liver function tests, as well as platelet aggregation studies. Smoking can increase catecholamines, cortisol, white blood cells, the MCV, and hemoglobin, and it actually decreases the eosinophils, which is a type of white blood cell. Smoking also can affect arterial blood gas results as well. Stress, so if the patient has anxiety, crying, or hyperventilation, that may affect test results, which can include the stress hormones, which is produced by the adrenal cortex. Diurnal variation, so certain specimens must be collected at specific times of the day because they can change throughout the day. Fasting, prolonged fasting increases bilirubin and fatty acids. A fasting specimen should be taken 8 to 12 hours after the last intake of food. Age, so many laboratory values actually vary within age. So for an example, we have organ function will start to decline when you start to get older. The values affected by kidney or liver function are different for elderly than for younger patients, and we actually have reference ranges that reflect that as well. The altitude, so patients living at a higher altitude have less oxygen available to breathe, so the body will compensate by producing a higher red blood cell mass. So they may have, if they live in like Denver, let's say, they may have a higher white blood cell, hemoglobin, and hematocrit level than somebody living, in Iowa or Illinois. Dehydration, so prolonged diarrhea or vomiting can cause loss of fluid from the intravascular circulation. Sex, so the normal ranges of some analytes will differ between males and females. And then pregnancy, so the changes that occur in pregnancy can affect lab results as well. The presence of the fetus and increased water retention can cause a dilution effect that is going to basically make a falsely low hemoglobin and red blood cell count, as well as other analytes too. Specimen collection, site selection. So site selection are going to be the sites that cause specimen contamination include hematomas or areas with edema and the side of the body that has undergone mastectomy or is currently receiving IV fluids. When a patient complains of stinging, pain, or tingling at or near a puncture site, immediately stop the procedure and find a more appropriate site. For a tourniquet application, tourniquets should be left on no longer than 1 minute to reduce that hemo concentration. Once blood flow is established, the tourniquet must be released, and tourniquets applied too tightly can actually cause petechiae in some patients. Site cleansing, proper cleansing will reduce the risk of infection. Blood culture collections require special care to prevent contamination of the sample with skin flora. And then as part of that QA program, microbiology department keeps records of blood cultures that have been contaminated with normal skin flora. And a lot of times this is going to be a training type of thing. So if we notice that we get a lot of normal skin flora contaminants and it's all by the same phlebotomist, then we can actually do some training with that person and try to prevent it from happening again. Site cleansing again, so iodine must be removed from the site after collection because it can irritate the skin. Iodine should not be used for a dermal puncture, and it can interfere with bilirubin test, uric acid test, and phosphorus test as well. Specimen collection and labeling. So specimen collection must be collected in the right tube for the test ordered and in the right order. Sample volume must be matched to quantity of additives in the tube. Tube size should be chosen to provide adequate volume for test required. Sometimes that means choosing the bigger tube. Sometimes that means drawing two. You'll get used to what you need to do. Labeling, incorrect or incomplete labeling makes a specimen useless and requires redrawing the specimen at a later time. Patient's perception. So always remember that the patient's perception of the level of care he or she receives is going to directly be affected by the skill, professionalism, and the care that you showed when you were with them. So this perception reflects not only on you, but the entire laboratory and possibly the entire organization. So break the chain of infection by performing hand hygiene upon entering and leaving the room and by wearing gloves during the procedure. Accidental puncture. So accidental puncture with a used needle must be reported immediately to a supervisor. QA procedures include monitoring the number of accidental punctures and instituting additional training or equipment modifications in the event of frequent accidents. So this would be something like if you drew a patient and then you accidentally stuck your finger with the needle. This would be an accidental puncture example. Transportation, so specimen transportation variables include the method of delivery, the treatment of the sample during transportation, and the timing of that delivery. Samples requiring either cold or warm temperatures during that transport must be placed in the appropriate container, and it needs to be handled appropriately as well so that temperature is maintained throughout that entire transport process. Separation time, so no more than 2 hours should elapse between the time a specimen is collected and the time serum or plasma is separated from the formed elements. After this time, the sample will begin to show falsely lowered glucose and falsely elevated potassium and lactate dehydrogenase levels. Centrifuges must be calibrated every 3 months with a tachometer to ensure that they are running at the reported speed. Variations may indicate that the need to replace worn parts is needed as well. Evaporation of liquid, especially from small samples, can actually affect test results like the ABGs or arterial blood gases, alcohol, and ammonia. Contamination can occur as well if the sample is uncovered, which arises from airborne dust or talc from the gloves. Contamination may also occur from incomplete separation, such as when red blood cells are left on the sample. So if it doesn't spin down all the way and some red blood cells are hanging out in that serum and plasma, it can also cause some issues with lab tests. Refrigerators and freezers. So temperatures of refrigerators and freezers are actually monitored daily with the temperatures recorded either automatically or manually at certain times throughout the day. Temperature readings that are too high or low indicate that the unit needs maintenance or replacement. So we, depending on where you work, you may be responsible for taking these temperatures. And it's just very important because we need to make sure that we have all of our specimens in the right temperature and that we have all of our reagents that we use in the right temperature as well. Aliquot handling and labeling. So multiple aliquots prepared from a single specimen can help different departments to share a single sample for multiple tests. Each aliquot must be properly labeled with 2 patient identifiers, so we know, one, who the patient is, and then we also need to make sure that we have the additives present listed as well. Analytic variables. So an analytic variable is any variable that can affect the testing process. So although most samples are tested by your medical laboratory scientists, MLSs or MLTs, they are going to usually be the ones that are training the phlebotomist in these CLIA wave tests. So if pipetting of reagents is required for a test, improper pipetting technique may yield results that fall outside the expected range or falsely fall inside the expected range. Post-analytic variables, so this is anything after the test has been ran. So the phlebotomist may be responsible for reporting point-of-care test results that he or she performed. That would be considered a post-analytical variable. The method of delivery is determined by the facility, so it could be entering the results into the computer, it may be calling on the phone, it may be by fax. It just is really going to depend on where you're working.